Queens, we do predict a fall surge. However, and this is most important, we have the tools to prevent it if we're following those protective rules from public health. If we're wearing our masks, keeping social distance, there's dramatic impacts in terms of the rate of slowing down any spread of disease. So when you talk about a surge and what we can see if we don't do that, it will be a larger surge than what we just experienced.
The reality is what really impacts the community is infection rates in our community. And as those peak up, we do see economic activity drop off. And it's not so much the policy action that's driving economic impact, it's just the rate of infection.
And from what I've seen, Hawaii employers have been very concerned about developing and enforcing safety plans because they do not want their employees to be contracting COVID and taking it home to their families. So the safety plan should account for the protocols that we have been discussing this evening: distancing, sanitation, hygiene. Some employers will have their own contact tracing programs in the workplace. So everybody should make sure that they understand what their employer safety plans are.
The 72-hour pre-travel test has been quite effective. And so that's the result that we would hope for, is that the fact that we have a test, and then the fact that the far majority of those tests have come back negative, tells us that the prevalence rate of those coming into our state continues to be extremely low. In fact, exposing very little risk to the residents as they come into the community.
But the real issue is, how can we get better? Because as we get better, as we control the virus better and better, that allows people's livelihoods to begin to be repaired. That allows small businesses to go on and prosper. And that allows us to keep each other just that much healthier. I think that's really the big issue, not so much how well are we doing relative to other places.
So I can say with confidence, all of our health systems are much stronger than we were in March. We are learning every day, and we do not take any day for granted. And the preparations continue with great intensity. And I hope that we don't have to use what we have. I hope that we have over-prepared, but we are not stopping, because we will be prepared to care and to have the access you need.